Welcome everyone to this discussion on public sector's communication conundrum and how to support staff deliver effective services and improve lives whilst overcoming technology silos. I'm Mark Blanchard, the Public Sector Director for GovNewsDirect, and today I'm joined by Pradip Karanjit, Deputy Chief Operating Officer at North West Anglia NHS Foundation Trust. Pradip, great to have you with us.
Thank you, Mark. Good to be with you today, and thanks for the invite.
So, Pradip is an accomplished healthcare management professional. Hailing from Nepal, his trajectory within the NHS has notably highlighted by his roles as Head of Access and Capacity and various other NHS positions before rising to the position of Deputy COO, showcasing a rich history of leadership. His insights extend beyond his career path, encompassing comprehensive explanations of the NHS structure, the job market, the NHS graduate management scheme, and his wealth of senior management experiences spans operational management, communications, engagement, clinical safety, governance, and project management. His dedication to maintaining a collaborative approach with clinicians and managers alike to enhance patient care was also recognised through his receipt of the NHS Trust of the Year award at the GG2 Leadership and Diversity Awards earlier this year. So, Pradip, great to have you with us.
Thank you.
This year, GovNewsDirect partnered with the communication technology company RingCentral to survey the public sector and analyse their rapid adoption of innovations in areas like cloud communications. Over 500 participants completed the survey. More than half were of C-suite director and senior management positions, and 20% of all respondents represented healthcare organisations. So this series of talks are to examine some of the insights and opinions and real-world experiences coming out of that research. So Pradip, I'd like to start with, when it comes to communications within public sector and indeed in healthcare, still very reliant on things like email. 96%, in fact, still rely on email when it comes to communicating. 87% are still using postal communications. So which communication channels are predominantly used by NHS Trusts to interact with patients, and how do trusts assess the effectiveness of their communication channels in order to enhance patient experiences?
Thank you, Mark. That's really great questions, and I think as you've alluded to in your question itself as well, I think we're still in a hybrid mode. So we're wanting to transition from the paper-based or manual communication mode to a technology available. And I think if we just look at the way we interact as well, previously before pandemic, if we've talked about you would have a Teams meeting, you'd have a video conferencing, would have said rubbish, that's not possible. We migrated to pandemic forced us upon that. Similarly in healthcare setting as well, we've been talking about virtual communication, the way of digital integration into how we interact with our patients, be that video conferencing in a virtual setting to see them, because not everyone needs to be seen and not everyone needs to be returned to manually. We all have technology in our private life. If you look at our life revolves around the iPhone, Samsung phone, Galaxy phone that we have. Everything is in there. But when it comes to public sector healthcare, we almost want to wrap around our patients to say, no, actually, they can't, because they can't use it. We need to write to them. We need to call them. In a way, I do understand that. There's a reason behind it, because in a commercial setting, for example, you're not getting a communication, might just be you missing the flight and reputational damage for airlines and compensation, financial loss. But in healthcare setting, it goes much more wider than that. It could be life-threatening. Might be someone missing the life-threatening appointment for them. We don't know at this point in time. So therefore, we've got around to this nature of saying, you know what, we just absolutely make sure everyone gets it, everyone is wrapped around it. The risk-based approach potentially. But that being said, over the last couple of years, I think post-pandemic, we've started seeing migration from that to we have a digital technological solution, we could use it. In our trust as well, I think most of our appointment communication is done digitally. We send a letter out and patients can open on their digital device. And again, just to safeguard, what it does is if someone doesn't open within 10 days, we send a manual letter out saying, look, you haven't, so therefore this is your appointment. And we monitor that pretty closely. In some cases, are we overdoing it? Yes, because some cases I know my appointment, I just see on my mobile, so therefore I'm not bothered to open, so I might get another letter sent to me. But at least what it does, it safeguards those patients. So we are well integrated in NHS setting as well. Different NHS hospitals are in a different stage of that maturity, digital maturity. So we're all wanting to migrate towards. And that one form of communication I've described to you. Now, what we are working towards is patient portal, whereby actually we deliver some of the messaging on the portal itself. So we're not worried about you having to open. It's there. It's delivered. You could see when you want it, and also you could communicate to us via that. So we're working towards that as well increasingly. When we look at our success rate around the digital comms for our patients, we upload about 60% of our appointment communications onto that digital platform or via digitally. In some cases, of course, we've got elderly populations and some children's vulnerable, so that get excluded. So that's where the 60% comes in. Of that, about 89% is the notification rate, and then 62% are viewing. So we're still sending letter to that 38%, but gradually I think the position we wanted to move towards is getting everyone that digital confirmation, everything done digitally.
Mm.
And in terms of, sorry, Mark, you had a follow-up question as well. How do we assess the effectiveness of the communication? I think that's where I think in the context of the appointment confirmation, I think what we look at is the did not attend rate.
Yeah, bringing that down.
Absolutely, bring it down. And also we in our questionnaires as well, we continuously ask our patients how effective it was, the way we're communicating, what part of it you liked, you didn't like. Not only the deployment or delivery of the messaging, sometimes how we're messaging is important as well, isn't it? The wording of it, whether it was easy for them to read. And we constantly survey on that with our patients as well, and we take that on board to continuously improve. So there are a couple of mechanisms where we monitor the effectiveness of our communications.
Interesting. So, one of the things our survey identified was a number of challenges when it came to replicating the, I suppose, internal staff communication method success, which organisations have adopted quite widely, like you mentioned, using Microsoft Teams internally to communicate and collaborate amongst colleagues and departments or other internal messaging applications. Being able to replicate that success to then externally with patients or other third-party stakeholders that the NHS needs to engage with. Can organisations proactively address those disparities in communication effectiveness? And how can overcoming the technology silos help bridge those communication gaps?
Absolutely. Again, the point I've made earlier around there is that awareness, willingness, or almost need identified to move towards and opportunities as well. Just to give you example of, I think before pandemic, we didn't know about the virtual appointment on an ad hoc basis. We used to do in certain specialties, video conferencing. We used to call that as a pilot. And I still remember in some cases when I recommended to one of the service, and they were almost going on, absolutely, we can't do that. And all of a sudden, pandemic falls. Now we almost regularly see about 25% of our patients in a virtual setting. So we have those conversations using either video conferencing. We've got a number of different technologies available, or even telephone. In some cases, we just need to speak to patients, absolutely. But in terms of can we go wider and faster, again, coming back to my point earlier around the safeguarding patients, in some cases, what we find is the inequalities access to healthcare. Not depending on the population where you are, not everyone is fortunate enough to have that access to digital platforms, and that's where sometimes it becomes a barrier. And sometimes in some cases, I think as healthcare managers and professionals, we overthink it on the behalf of our patients, clearly, because that's the profession we're in, so we have to worry, we have to be concerned about. And therefore I think we probably need a bit more foundation or infrastructure, probably at national level, if that's the direction of travel we're going, saying, you know what, digital maturity is not only for the organization to implement, the society needs to come along with it as well. Probably private organizations are slightly different, but as a public sector, we've got responsibility for our population, isn't it? Therefore, I think that thinking about infrastructure wise, are we as a society ready for that digital integration? What infrastructure we need to build into? And if we have those mechanism foundation in place, what it does is it gives us much more greater degree of confidence to move into that digital area, saying, yeah, when we set up a Teams call appointment for our patients, we know they have a laptop, they have a broadband connectivity, so they're not going to miss their appointment. We've seen during our pandemic as well, there were multi-tier system for different children's at school, isn't it? Some were effectively being able to access their education online, some couldn't. We saw some disadvantaged families suffering from that, isn't it? That's education. We probably can live with saying, you know what, there's a generation that have lost 1 or 2 years of education. But when we bring that into healthcare setting, we couldn't forgive ourselves saying, you know what, because of that gap, someone has lost a life. And that's where I think we worry too much about, is it rational? Is it necessary? One could argue probably in a public health setting, when you multiply, probably may not be, but I think it's our responsibility to make sure the equity of access is there, and we do that impact assessment just to make sure that our patients are not lost in that translation of lack of provisions. And I think that's where some of the challenges that we have. So therefore, from my perspective, is organizations such as ourselves, healthcare providers or public sector, can move into that space. Technology is there, whether as a society we are ready to replicate that from other end, so that there is that the middle joint whereby the provider and the users can meet.
Yeah, you make a very good point. I think when you look at the how we communicate organisations to our customers or patients or society, there's those who are vulnerable, who just don't have the technology, and I suppose especially in healthcare settings, you you need to take those things on board. But it's refreshing to hear that you've got that kind of omni-channel model set up where you're ticking the boxes for all the different demographics and ensuring that the communications, because they are such vital communications in healthcare settings, are being considered. How do you feel when it comes to current communication channels used by NHS Trusts? How do you feel? How well are they integrating with existing business applications, whether that be your 365 or electronic record systems? And what steps NHS organisations taking to address integration challenges? The reason I ask that is 41% of all of our responders said that they had little or not at all when asked how well their communication channels integrate with business applications. Is that something that's slowing you down when it comes to effective communications?
It does. I think that I will answer that in twofold. Yes, we poor as well, and also within that, again, when I say poor, we have an NHS organization, different organizations again are in a different scale of that spectrum in terms of digital maturity. And in some cases, I think integration is not well established in healthcare. Their systems are integrated, but halfway only, one way comes. So one way comes out of our business systems, our patient portals, patient access pass systems, and all of it, electronic patient record. And there's a reason for that as well. What we need is, again, our healthcare systems are heavily safeguarded from information data breach governance and all of it. Isn't it? Your personal data protection is crucial, important. Your health records are heavily safeguarded, protected. Once we have that integrated system with another provider, if we haven't got that fail-safe mechanism, we've got potential issues around the two-way messaging side of it. For example, let's say the two-way comms, the appointment system I talked about, we have a system where appointment gets dropped, but we haven't got a system where patient would just come back and say that appointment 4:30 isn't suitable for me. Can I book tomorrow 3:50? A is around that two-way comms potentially impacting on for data breach. B is around what we don't know is, unlike you booking your flight or cinema ticket, for example, as a clinicians, they have said, I need to see Mark, tomorrow 3:40 for clinical reason. As a patient, I may not be aware. I may think that I'm aware for 3 months. I will book that appointment in 3 months' time. So therefore, that could potentially put patient at risk. So therefore, what we want to do is make sure there's opportunity. If you can't make it, that you could notify us. Therefore, we could go back and clinically assess you around, yeah, deferring 3 months wouldn't put you at risk. So we're happy with it. Or someone picks up a phone saying, I really need to see you before you go away, so that we could sort you out before you fly. And this is why in healthcare setting it's slightly different to other public sector. But over time, I think once, as I mentioned earlier, around if we are digitally fully mature, probably we could move into that space around everything is well integrated, so we could take away those manual intervention. But at the moment, I don't think we are self-sufficient to safeguard or protect everything eventuality. So therefore, we're slightly cautious in how much integration we put in place, whereby we're not confident that we have safeguarded our patients from data protection, the clinical risk potentially, some of the examples that I've mentioned earlier. So we're slightly patchy on that front, but there is a good reason. I'm not making excuse, but it is one of the journey that we're starting. So we've got a bit more longer way to go, whereby we have business systems are well integrated. So we're into one platform. So there's a bit more work still to do, Mark.
Mm. So I want to touch back on a point you were making earlier about in terms of how we measure communication performance. You mentioned missed appointments is obviously a big KPI in healthcare settings. 43% of our responders said that when it came to communication channels performing, 43% said either fair or poor when it actually came to meeting citizen and patient expectations. Is the answer to this more and better reporting capabilities and analytics, dashboards in their communication channel performance? And how do you think we can take a data-driven approach to enhance our communication strategies and patient care?
Absolutely. I think the analytics, once we go digital, and I think we should have access to those information so that we could react and respond really quickly. For example, some of the data I broke into earlier, around 62% view rate and the rest 38%. Can we go further out to try and establish what that 30%, 38% account for? Is that 38% they have looked at, they've seen it, confirm, but they didn't want to open it. Therefore, are we generating another letter? I think sometimes what we get is patients getting really frustrated. You have sent me an appointment. I've seen it. Why are you sending me another letter? And it's quite rightly, from our perspective, we are trying to safeguard and protect. But as a patient, sometimes I do get as well a number of letters coming out. So therefore, almost I sometimes put myself into that shoes saying, are they undermining my intelligence? And that's where the experience side comes in, isn't it? Hospital can't even get that appointment letter sent. I've seen it already, but they're sending it. So they are how inefficient they are, how ineffective they are, and that's where the perceptions start building. So therefore, I think be more around analytical side of it, understanding that so that we could respond slightly differently probably would help. And that's where it comes to point around the digital maturity side of it. Once we've got fully integrated platform in all of it, that we can assure ourselves to say, yeah, the stuff that I wanted to communicate to our patients has been communicated to. I know our patient will turn up for their appointment. And when they don't, again, do we have a mechanism to go back and look at why they have not? Is that because we assume that they have received the appointment, but they haven't opened it? So therefore, how do we correct that for the future? So that's an ongoing iteration process, and we do that. The appointment portal that I mentioned to you, it's in real time. So we could see how many patients have responded. In some cases saying, I don't want to keep the appointment. So therefore, we respond to that as well. We track that effectively. And going forward, clearly, as we start integrating more and more those digital solutions, of course, and with digital solutions, the beauty of that is whatever you put in, you could extract it and play with it, use the analytics to inform your decision making. And also in that, what we need to do is combine patient's experience side of it, what patients are saying. So therefore, we could enhance the experience for them and use of technology as well, get better out of what we have.
Hmm. What I'd like to finish on is a big, interesting topic at the moment, AI. We asked a lot of our survey respondents questions around AI adoption and usage in healthcare settings is increasing, as we all see every day in terms of things like diagnostics. But AI in communications has been much slower. In fact, our survey respondents were in huge favour of using more AI to improve communications with citizens and patients. In fact, I was reading only recently there was a large utilities company that has actually now adopted a similar kind of platform to ChatGPT in order to write the content of the letters that they send out to customers of utilities, saying that, going back to what you said about content being crucial in those letters, and it was actually being able to track and manage and monitor the engagement levels. Customers were far happier with the content being written by AI than they were by a customer a customer service representative. What do you think around the primary factors contributing to the hesitation of adopting AI solutions when it comes to communications, and what positive steps can healthcare organizations implement to overcome these obstacles and embrace AI in their communication channels?
I think it's boils down to the point I made earlier on. We are at the beginning of that journey, and I don't think we could 100%ly say that we have infrastructure at the organizational level. Our society is ready for that as well. That's one thing. The maturity of the organization, lack of integration, and all of it. But that being said, I think we're making progress. We're also looking at the tool that we're using to deploy our appointment. They have a solution which is AI based, the predictable DNA. So basically looking at the lot of background information, um, uh, uh, the previous history of the patients, the comorbidities, their social background, everything else, analyzing that. What it does is predicts potentially a patient, number of patients who are likely to be not attending their DNA. What it does is then it allows us to put interventions in place to say, are you aware you've got appointment? Can you make it? Do you need anything else so that you could attend? So we are working towards that. Hopefully over the next couple of months, there are some other solutions. As you mentioned, in terms of treatment, I think we have integrated already a lot of robotic surgeries and natural. Within that robotic surgery, there's a lot of AI interventions already gone in for diagnostic as well, for histology result, and also now they're looking at reading the images as well, X-ray and all of it. That's being tested because, again, with that, I think this is about, again, with that, you've got medical context, isn't it? You've got almost yes or no. Someone could look at it and say, yes, that it read really well. Whereas in social context is slightly different. So therefore, I think, and also at the same time, the stuff that we talked about earlier, the digital maturity journey, we've been at the beginning of this. So therefore, we haven't gathered that enough intelligence to throw this at artificial intelligence to say you've got enough information, play with it. And also the point I made earlier around us wanting to protect our patients more, probably in some cases quite rightly, but it's holding us back as well. I think we probably just need to consider, take a step back and say, you know what, technology is there, let's test it as much as we can, protect, safeguard, let's go with it. But that being said, I think there's a lot of providers in the market, and we're making really good progress around looking at AI for in the sense of communications as well. Absolutely. And just in terms of printing letters as well, what we have is where historically we would have printed a letter and inserted additional informations. Now we've got technologies in place whereby a letter carries a barcode. Based on that, if it is for specific clinics, can you insert the second copy? It gets inserted into. That's in a way is already use of technology to reduce some of the workload. But what we're talking about is artificial intelligence really taking part in driving that forward. But as I mentioned earlier, we're at the beginning of that journey. Watch the space. I think healthcare will make some progress over the next couple of years as well. And NHS Digital is driving that digital maturity agenda really, really hard. So over the next couple of years, there's ambition for majority of NHS providers to be digitally matured in that journey.
Mm. Do you think we'll ever get to the stage of virtual healthcare assistants? In terms of, obviously we can go online, we can type in or tick boxes in terms of, yes, I've got a sore knee, yes, it's swollen here, and it gives me a rough idea of a potential diagnosis, which leads to a conversation. But do you think more virtual engagement, AI engagement is on the cards?
I think absolutely the opportunities are endless. The technologies are there to help. It's about now integrating them into our workflow and getting those technologies to understand those social barriers and challenges and all of it so that we could safeguard our patients. But otherwise, I think if you look at NHS one-on-one services, well, though it is done manually, but it's almost that assessment, isn't it, going through? And the one of the issue is potentially that we may face to is patients are sometimes we are naive in our assessment, clinical assessment, isn't it? Saying, I've got a headache. Naturally, with what we think about is right, it's the worst. So therefore, we've got sometimes a habit of exaggerating that. Whether that could lead to potential some concern unnecessary bit, how do we manage safeguard that? I think we probably need to build something along those lines. But often we see that someone is sneezing and something is in the media. Everyone thinks we all have that COVID and everyone rushes to. And what it does is it kind of creates that unwarranted variation in the demand that we can't cope with. We can't get to patients who genuinely need access to the service. And that's where some of the challenge that we have. How do we make sure that patients are truly utilizing system without having to overwhelm it? So I think it's just about those protecting, safeguarding, and building those technologies to aid us in a right way.
Pradip, that's all we've got time for today. But thank you very much for talking to me and sharing your fascinating insight. It's been a pleasure.
No problem. Thank you. Thank you for the invite. It's been exceptionally pleasure as well as insightful for me too. And hope we meet again some point to talk about our digital journey. Personally, I'm very excited as well for that digital journey, how we could use that digital integration into the services we provide over the next couple of years.
Thank you very much.
Thank you, Mark.